Hi, good morning. This is Baljit, Dr. Baljit Kaur Gill. I'm from Hong Kong. Thank you for the invitation from the Cooperative University of Columbia, the nursing faculty for the International Virtual Nursing Week. I'm a member from Sigma Theta Tau in Asia, and I have been invited by the nursing faculty to give talk and presentations on advances in clinical simulation for nursing education in China. I'll be giving a presentation on advances in clinical simulation for nursing education in China. Let me just share a few minutes to introduce myself to every one of you. Okay, I'm an associate professor from Hong Kong Metropolitan University, and I have 13 years of higher education teaching and adopting nursing simulation in Hong Kong curriculum in baccalaureate level, postgraduate simulation educator at Hong Kong Academy of Medicine, teaching both physicians, staff nurse, and interprofessional educations. I have obtained my Doctor of Philosophy in 2017, which is the first thesis on assessing the effectiveness of using simulations among baccalaureate nursing students in Hong Kong. My thesis title is Human Patient Simulations Improve Nursing Students' Competence in Providing Nursing Care to Older Adults Experiencing Acute Stroke, a randomized controlled trial. This is first of the simulation in Hong Kong, first thesis, PhD thesis on simulation in Hong Kong. I've also been awarded that Best Abstract and Oral Presentation in second UAE Clinical Simulation Conference. And regarding simulation, I have adopted secured several multiple funded simulation projects as well, such as cultural adaptations of NLM, simulation evaluation scales, evaluating students' performances, high fidelities in respiratory care and airway management skills, and others. I've also been invited for a number of keynote speeches on simulations in Hong Kong. I'm an author and editor of one of the nursing education book, which is Technological Innovation in Nursing Education and Practice in Hong Kong. So let us start with our today's presentations on how advances of clinical simulations for nursing education in China. So let me just give you a brief history of what is simulation first. So using simulation is in the history of using simulations, it started with aviations. So around 4 decades ago, aviation industry has first used simulations as training risk situations in them. Aircraft simulations demonstrated performance improvements in real aircraft than only using aircraft training. So it has a huge improvement in the safety. It is later concluded that simulation-based training is mandated in aviation training. It was later adopted in medicine as well, and later in nursing educations. Medical simulations has been used, the use of simulation in medical education has been used in the 1960s. So we have been using high-fidelity medical simulators for educational, effective, and complementary to medical educations. Simulations was later, after medical usage, it was later used in nursing education as well in the early 1900s, beginning with simple manicures in scale laboratories and later high-fidelity simulations. Later, in National Council of State Boards of Nursing, NCSBN, have also suggested that and proven that high-fidelity simulation is equivalently replaceable to half of the traditional clinical hours in 2014. In later development of simulations in nursing, the National Council of State Boards of Nursing, NCSBN, have also suggested that high-fidelity simulations could equivalently replace half of the traditional clinical hours as well. And with the development of International Nursing Associations from Clinical Simulations and Learning, INACSL standards, provides a guide for faculty to develop the plan, design, and implement elements for assessing the needs, constructing measurable outcomes, formatting our purpose, and developing scenarios for high realistic fidelity. Using simulations in educations can be proven to be adopting the famous Bloom's taxonomy, which differentiates between cognitive skills and clarifies learning objectives that required high levels of cognitive skills. There are 6 levels of cognitive skills according to Bloom's taxonomy. which is remembering, which can be easier defined as recall and recognizing. Understanding, which is summarizing. Applying, which is implementing. Analyzing, differentiating and organizing. Evaluating, which is critiquing. And creating, which is producing. The learning can be measured using there's another famous for simulations models, which is the Kirkpatrick model to evaluate simulation outcomes. The learning outcome measures which can be assessed according to that model is knowledge, skills, and attitudes. Reaction, perception, outcome measures can be measured with the changes in the behaviors or performance following simulations, appraising self-confidence and critical thinking. And later, behavioral performance outcome measures can be used in evaluating high-level thinking with changes in behaviors and performance. I've been introducing some of the simulation tools that have been used and development of nursing simulations, such as NCSBN and ISCN, shows that simulations is very effective to be used in nursing educations. But very often, how we are looking at nursing education these days, and why do we need to use simulations? One of the things is, like Hong Kong, China, and other many Western countries as well, we often face the difficulties of coordinations of theory that nursing students learn in the higher education institutes or nursing schools, then applying them into practice. And simulation is having this kind of beauty that is helping them to practice realistically in hospital, realistically in the school, and they can apply the theories more competently in the clinical settings. So often we see that there is a lack of coordination between theory and practices in nursing educations. Nursing students often encounter difficulties in the practical implementations of the theoretical knowledge as well. The difference between the theory and practice complicates the learning process and limits the understanding of nursing terms and concepts. Before simulation is actually adopted, where we often find that students complaining the things that they have practiced in the simple skills lab, nursing skills lab, when they go to the ward, they cannot practice that. So why, we have actually adopted simulations to help them to feel the realistic of what is learned and what can be applied. Simulation bridges a gap between the classroom and clinical skills. As I described earlier, simulation have actually, because there's a deficit, like the discrepancy between the theories that the students have learned and applied it in simulations. That's why simulation is helping to them. Nursing courses that have been taught in lecture formats or educations students are usually sitting in classroom only. Simulations, even though we have nursing skills lab, only simple manuscript skills can be used. Simulation replaces and complete real-life experiences. It uses real-life mimic scenarios. It could also use for teaching theoretical clinical skills and enhance critical thinking of the students, which can be actually described as it is teaching not only the skill-wise, the technical skills, that means the bedside cares for the students, but at the same time, simulation enhance real-life experiences, help the nursing students to think they're really working in a ward, which actually improves their non-technical skills as well. What are the non-technical skills? Actually, such as critical thinking, clinical judgments, communications with other staff, interprofessional practices. But now, as I've said, as I was introducing you to various simulations, the effectiveness of using simulations, and now I would like to accentuate on what is happening in China and Hong Kong. Overall, as you can see, China is a big country with Hong Kong as one of the cities in the mainland China. So I'm from Hong Kong, but from what the experiences I get from China and Hong Kong situations on simulations are relatively a little bit different. So I'm going to share my experiences with the simulation development in China and Hong Kong as well. As you can see, this is the China Simulations Lab. Nevertheless, in China, because it's comparatively a very large country, and in China, we only have a simulations lab in big cities and well-known university. Very often in the suburban places, they don't have a simulation center. The simulation development in China is relatively slow. Comparing, when we look at Many simulation centers are only established in big cities and focusing on only medicines. Till now, simulation centers are mainly focusing on medicine practices as well. But comparatively, when you look at Hong Kong, which is known as one of the city of China, of mainland China, you can see in Hong Kong there is multiple centers have developed. We got universities set up with simulation centers. Some of the university centers have actually get accredited by ASIPH, which is the simulation accreditation center in the United States for the development and for the clinical cases that they have been using. So in simulations, you can see we also have in Hong Kong, we also have various organizations have developed, such as the Hong Kong Society for Simulations in Healthcare. Well, comparing Hong Kong from China, in Hong Kong, we have more well-established professional bodies and simulations, and tertiary establishment in hospital and higher education institute as well. As I was thinking about these presentations and introducing what is happening of simulations in China, but I could not really bring these two countries, China and mainland China and Hong Kong together, because the simulations development in these two countries are very different. In China, in mainland China, as I've told you that, simulation centers are very limited, and they are only in urban cities or well-known universities have established it. In suburban areas, there's not much. But comparing to Hong Kong, every Hong Kong Nursing Higher Education Institute or nursing school, they got a simulation center. And we got professional bodies, we got physicians having their own simulations as well. But one thing is, comparing, you can see the two countries are using simulations very differently. But when I say using simulations in Hong Kong and comparing to Western countries, Hong Kong is still a little bit backwards, okay, comparing to all the development of simulations in Western countries. I have actually searched on some of the articles development of simulations in China as well. As you can see, in 2013, there is only a limited, when you search in Google, there is only a limited publications of simulations in mainland China. And as you can see, like I have retrieved a few of them, it's like one of them is in 2013. They are just assessing the simulation methods of BSN students. Chinese, how they feel moderate fidelity is different from high fidelity simulations. And in 2021, they are still just assessing using high fidelity simulations, teaching nursing students. So just the most recent one is in 2023, the learning experience of virtual simulation class. As you can see in these three articles, why I have been accentuating using these three articles to explain the simulations conditions in China. You can see the simulations, the three articles, the research papers are only evaluating on the simulation method. While when you compare to Western countries, they are already discussing simulation in various situations in various, such as in advanced airway management. And they're very specific on a certain kind of, say, for example, they are already assessing how simulation could improve a nursing student's competence in taking care of patients who are deteriorating patients. So one of the things is actually, you can see there's a huge difference on simulation, even in research base. In China, they are still just evaluating of is it good or not. They haven't even really stepped into a state that discuss on different kind of simulation scenarios. So it's relatively a little bit back comparing to Western countries. But as we look at this, why is it like this? Okay, one of the thing is because underdeveloped teaching approaches in China, in mainland China, because there's only limited, because in mainland China, Mandarin, spoken Mandarin is the main language, it's the first language, and written tradition, simplified Chinese is another, is the main language as well. Till now, there is only one or two books. The first book was actually developed in 2017 on simulations in Chinese language. So you can see that it's only a limited, that is actually meeting their language that can help them to develop the simulations. So this is one of the things that is actually prohibiting the development of simulations in China. And then as we can see, there's a lack of professional bodies and simulation as well. There is no formal training, instructor trainings for simulations in China, in mainland China. And simulation faculty staff development are also limited. There's a lack of support for faculty staff's training as well. Recognizing recognitions of completion, there is, even though in much of the countries developed in Western countries, in US and Canada, you can see the development of the healthcare professionals. When they enroll in a simulation program, they got recognitions, they got certificates for their effort, for the knowledge that have they gained. But in China, in mainland China, and even in Hong Kong, we don't have that yet. Okay, so there's a lack of standardized simulation-based training as well. Another thing that is actually limiting the development of simulation in mainland China is the research, as I've show you the previous slides. The research is still very superficial level, just determining the level of simulations, like modalities, which is high fidelity or which is moderate fidelity. They haven't really explored how a scenario can be developed in the simulations to enhance, say, for example, the students, the healthcare professionals, or the medical or nursing students, critical thinking, clinical judgments, and other things. And most importantly, one of the things is there is lack of funding supporting them for the development of simulation as well. For evaluation scales, according to my knowledge, there is only 3 assessment scales that have been developed for mainland China for assessing the effectiveness of simulations. The first one is the Mandarin Chinese version of Simulation Learning Effectiveness Inventory. The DASH, which is the debriefing assessment for simulation in healthcare, is still in the translation process. And the last one is actually developed by me by translating the NLN educational practice questionnaire, simulation design skills, and student satisfaction and self-confidence in learning skills to them. So actually, when I translated these skills, I have actually a number of requests from mainland China for using this scale for evaluating simulations, not only in mainland China, also in Hong Kong as well. Because this is the first scale that is developed in traditional Chinese. Traditional Chinese is mainly used in Hong Kong, but it can also be used in China as well. So I hope by the development of this scale could help simulations could improve the development of simulations and evaluate the simulations in nursing education and curriculum as well. When I talk about Hong Kong now, I think Hong Kong simulations, actually I have 13 years. I have 13 years of using simulations in educations. But 13 years ago, when I first touched simulations in my university, Hong Kong Metropolitan University, we were actually in a development phase, and it was really a new teaching ideology that was adopted in Hong Kong. We were one of the first universities that have actually been using simulations in nursing education extensively. So how could I say that why we were not adopting simulations? Because Hong Kong is relatively traditional in nursing education. When comparing to Western countries, they have been using simulations widely already over 50 years ago. But only it's like approximately 10 years ago, simulation was only like a rising star in Hong Kong as well. But the development of Hong Kong actually using simulation was actually roasted because of the COVID outbreak. Before the COVID outbreak in 2019, traditional teaching methods such as using simulations was more like a voluntary educational means. It was not really accepted by the Nursing Council of Hong Kong. And usually simulations were only used in school by a group of enthusiastic nurse educators who want to use simulations to describe real-life situations for the students. Recognitions of using simulations in curriculum was not recognized like 13 years ago. But with the COVID outbreak, because I think 13 years ago, nursing curriculum in Nursing Council, where you need to get a professional body's license, they required you a certain number of theoretical hours and certain number of clinical practice hours. Those clinical practice hours is mandatory that you need to practice in a hospital settings. Comparing to Western country in US in 2014, they have already used a certain part of clinical practice hours replaced by simulations. But Hong Kong was not allowing that even 13 years ago. Like in the US, it's in 2014, which is 10 years ago. But in Hong Kong, it was 10 years ago, we still couldn't do that. So what happened is in COVID outbreak, all the clinical practice sites were closed because to prevent the outspread of the COVID. All the nursing students were required to only have certain amount of safe practice in safe wards. So what happened in that year that they need to think, we thought that COVID is going to stop like a couple of months, but we didn't know that it's going to last for years. So educators and nursing council of Hong Kong start to think about like we can't just pause everything. The nursing student needs to be graduated. If not, we will have a shortage of nurses. So what happened is they start to think about adopting simulation for the replacement of clinical hours at that time. A lot of meetings were held and compromising how are we going to replace, what kind of scenarios or what kind of objectives the simulation scenarios need to be adopted. So different bodies from the universities have sit around the table and discuss what kind of clinical practicum that they will be using for this. The Hong Kong Nursing Council eventually accepted replacing the clinical hours, only certain hours, 18 hours to be replaced later on. So, but this incidence of COVID outbreak have actually increased the acceptance of using simulations in university nursing programs. It was a huge step. And now the hospital authority, which is the management committee for the order of public hospital in Hong Kong, they have also been accentuating of using more simulations for the students to improve their clinical skills when they got graduated. So this is a very, very big step. But when we look at this and compare that to China, even COVID was broke out, China was still a little bit backwards on hesitancy. One of the reasons is because the development and the case scenario developments, such as the cases, such as the environment, the simulation centers, there were only limited simulation centers. So they couldn't be like Hong Kong, the whole territory was running like this simulation replacement of clinical hours. So this is the end of my presentations, and I will be very happy if you drop me any emails, drop me any questions that you want to ask me. You can also seek me, and I can we can have research together, seeing how simulations is going to impact in different countries. Say, for example, in Colombia, and comparing to China, or the teaching styles of the students in these two countries may be different as well. So don't hesitate to find me, and I'm more than willing to share all my thoughts, and we can work together to improve more simulations in nursing educations. Thank you so much. Have a lovely day today.